Hi everyone, welcome back to XGate Dental. I'm Emmanuel Kadosh, and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases. So let's get started. Today we're going to be looking at a case with 2 crowns on 2 implants, and we want to show a couple of things in this specific case. First of all, there was some inflammation around the crowns and around the implants, and this was because food got stuck between the crowns and the gingiva, and the patient didn't clean it properly. So the gingiva got inflamed around the piece of food that was stuck, and we need to take out those crowns and clean around the implants. We left it for a couple of days to heal, and the second thing we want to show is the difference between the Zirconia crowns and the PFM crowns that you can make. In Zirconia crowns, you can make the screw channel much smaller than in the PFM, and we'll show the differences. These are the crowns. You can see that the bridge made of 2 crowns with 2 screws above the crowns. When you're making a PFM restoration without sleeves, without anything, the screws must go through the crown. So the screw channel needs to be in diameter a little bit larger than the head of the screw. So if you have a screw, for example, like 2.3 millimeters, you need to have a screw channel of about 2.5. For a crown, 2.5 for a premolar, for example, it's almost half of the tooth. So most of the occlusion part is the screw channel around, which means that it's weakening the crown. And the amount of metal and porcelain it has is less than normal. So if you'll have a small screw channel, you have much more material to strengthen the crown. You need to have the screw channel where the screw goes through, so you have no other option. Because you don't have enough space for the metal and you don't have enough space for the porcelain, this is why it's more prone to chipping. This is why when you have a monolithical Zirconia crown, it's less prone to chipping because you have a lot more material. The occlusion part is fuller. Here you can see where the food got stuck between the multi-unit and the crown. These are very old multi-units and implants. I think they were made around 15 years ago. In this case, when you have some inflammation, you need to react immediately. You need to see it immediately, and you need to take out the crowns and give it a little bit of time to heal up. What we did here is we took out the crowns, we gave it about 2 days, and ultimately the results were amazing. The inflammation was basically gone with 0 antibiotics. This is why when you have implants, you need to clean up everything around those implants. Just because you can't have caries doesn't mean that you can't have inflammation. You can have lots of different issues, and you obviously still need to brush your teeth. The patient can brush his teeth much better now that we took the crowns out, and you see the results between what was before and what there is now. These are the crowns with the healthy gingiva and the healthy tissue and the big screw channel. You can see that almost all of the occlusion surface is the screw channels. So, to sum it up, the bigger the screw channel is, the more prone to breaking and chipping it is. Keep in mind that you can have PFM crowns with small screw channels if you cement a sleeve to the PFM. If you're cementing sleeves and doing all of these procedures, in many cases, you wouldn't do PFM and you'll do the Zirconia crowns. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more. And of course, don't forget to subscribe, like, and follow. Thank you and see you next time.